is on.
Good day and welcome again to the National Emergency Operations Center COVID-19 weekly briefing for Wednesday, the 12th of January 2022. Thank you for joining us for our briefing today. As usual, we continue to update you with what is happening in the Federation of St. Kitts and Nevis in relation to the management of the COVID-19 pandemic. Of course, as we all know, by this fourth wave, that the pandemic is still not over and that we have to manage as best as we could to mitigate the impacts on our health system and the impacts, of course, on all of us so that we can have a more productive and better society. So thank you again for paying attention to what is happening. I want to invite first to the podium Dr. Cameron Wilkinson, who is the Medical Chief of Staff at the Joseph N. France General Hospital. Dr. Wilkinson will be presenting us today with the Health Emergency Operations Committee Situation Report. He will be filling in for our Chief Medical Officer, Dr. Hazel Laws. Dr. Wilkinson.
Thank you very much, Lesroy. We would have been through this. I remember clearly, though, when I came here at the end of December, when our case count had dropped to about 6 or 8. We said, after getting out of the third wave, that a fourth wave was inevitable and that we were not helpless, and that we could go forward and get vaccinated to protect ourselves. So when the fourth wave came, we will be better protected. We also encourage persons to continue to use the non-pharmaceuticals. Well, we are in the fourth wave right now, and I still want to encourage persons to adopt the non-pharmaceuticals that we know protect us and to continue to go out and get vaccinated. As it relates to our vaccination status, I'm happy that persons are continuing to come forward to be vaccinated, and to date, the adult coverage with the first dose in the Federation of St. Kitts and Nevis, we have 81.7%, which is significant, and we have 76.1% of adults who are fully vaccinated. We know that it is the high threshold of adult vaccination coverage that is protecting us as we go through this fourth wave. We're also happy that persons have been coming forward in their numbers to receive their booster shots. We know that the booster shots offer significant protection, and so if you are 6 months out of being vaccinated, you need to come forward and get your booster. And so we have 7.2% of the adult population who have had their booster shots. The children continue to come forward between the ages of 12 to 17. We now have 17% of the teenagers between the ages of 12 and 17 with at least one shot, and 14.6% who are fully vaccinated. When we look at the breakdown of the Federation's figures by islands, we see that St. Kitts has a much higher vaccination coverage than that of Nevis. For the adult coverage with at least one shot in St. Kitts, it is 86.4%, and we are closing in on 80% fully vaccinated, that's 79.7%. Whereas in Nevis, the first dose is 69.3 and the fully vaccinated 66.8. I want to make an appeal at this point in time to everyone in the Federation of St. Kitts and Nevis, but more specifically the persons in Nevis to come forward to be vaccinated. The virus will eventually find all of us. However, we know that the vaccines protect you against severe disease, hospitalization, and death. You don't want to learn the hard way by the virus finding you before you have the necessary cloak of protection that the vaccine offers. And so I'm begging and pleading with you again to go forward to be vaccinated. We see that I'm not finished with that slide, is it? We see that the coverage among our children is still below 20% on both islands. Most of the adults have gone forward to be vaccinated. I am pretty certain that these children belong to the adults in our federation. And so if you did the right thing by putting on your seatbelt when you're in a car, you need to make sure that you fasten the seatbelt around your child also. If you did the right thing and you were on an airplane and you put on your mask first to get your oxygen, once you've taken care of yourself, you need to take care of your children. And so I'm asking the adults in the Federation who are in charge of these children to bring them forward to be vaccinated, to give them the best protection possible. Now, when we look at the number of confirmed cases to date, we have a total of 4,484 with 3,838 in St. Kitts and 646 in Nevis. Of these, 3,252 have already recovered in total, with a recovery of 2,726 in St. Kitts and 526 in Nevis. We currently have 1,204 active cases, with 1,089 in St. Kitts and 115 in Nevis. I am happy that so far during this fourth wave, we have not added any deaths, so we are still at 28 deaths. However, this again might be inevitable if we don't give ourselves the necessary protection. But I do hope that the death rate stays at 0 during this current wave. As it relates to the variants in circulation, we know from previous genomic sequencing and testing that we had the Lambda variant that was responsible for the first, second, and third wave, and we now have the Omicron variant that is responsible for this fourth wave. The Omicron variant is highly transmissible, highly infectious, and countries that have gone through a wave before, we have a rapid rise in the number of cases. The good thing is that the Omicron variant is presenting with a milder disease. However, to the individual, although the disease profile might be mild, to the country as a whole, based on the sheer volume of cases that you might see, it can still be catastrophic to the healthcare system, and so there is no place for complacency. We have sent off 25 more samples to be tested. These were sent off on the 5th of January, and the results are pending. With the transparency that we have approached this throughout the entire pandemic, as soon as we get those results, we will let you know. However, it's important for us to note that when we speak about confirmed cases or the confirmed variants, this does not mean that by chance there might not be another variant, but this is the scientific and documented evidence that we have. So far we know that we have the Lambda variant and the Omicron. I doubt that we had the Delta in circulation because we did not see the severe disease and death that other countries experience. I know that I've heard other persons say that the Delta variant was in circulation, but we had no evidence of that with our testing. If we are to look closer at the cases in this last wave that started on the 24th of December up until yesterday, we had a total of 1,662 new cases, with 1,490 in St. Kitts, 172 in Nevis. The females outnumber the males. About 48% of the cases are in males and 52% in females. During this period, we've had a total of about 30 hospitalizations, 6 in Nevis and 24 in St. Kitts. It's important for me to note here, though, that the hospitalizations, for example, currently we have about 20 patients in the Joseph M. France Hospital who are COVID positive. It doesn't necessarily mean that every patient who is COVID positive is there because of COVID-19 disease. Because the disease is so widespread, it is possible that one can have asymptomatic COVID disease, but you go to the hospital because you had a heart problem, a stroke, etc., and you're tested and you are positive. And so the number of hospitalizations doesn't necessarily reflect the persons who are there because of COVID-19 disease. Currently on the COVID ward itself, we have about 9 or 10 patients, okay, despite the fact that we have an overall of about 20 patients in the hospital with who are COVID positive. As I said before, we have had no deaths. What is good is that the recovery is great. And so of the 478 persons who have recovered so far, of these, 78% of these were persons who were fully vaccinated and 22% were unvaccinated. The experience we've had here is that those who are fully vaccinated, they are either asymptomatic or have very mild disease, and they become asymptomatic in a very short period of time, most persons within 2 to 3 days, and most of them are tested negative by 5 to 7 days, whereas persons who are unvaccinated, they have more severe symptoms, and they have a longer duration of our disease. And that is why we would test the unvaccinated persons under 10 to 14, because the virus stays with them a little longer. And so all this is evidence that the vaccination offers protection. So this slide, and this is a slide that some persons have chosen to misrepresent the information that is given here. Now, this slide says that of the persons who have been infected with the Omicron thus far, 80.2% of them were vaccinated and 19.8% were unvaccinated. We know that the virus will find all of us. The vaccine does not prevent you from getting infected. What the vaccine does, it prevents you from being severely ill, from being hospitalized, and from dying from COVID-19. If we have a situation where the majority of our adults in the population of St. Kitts and Nevis are vaccinated, it follows that if lightning was to strike randomly, it most likely will hit a vaccinated person. And so based on the sheer volume of persons who are vaccinated, the majority of the persons who are infected with Omicron happen to be vaccinated, but these persons are recovering at a much faster rate. They have asymptomatic or mild disease. And so COVID-19, although the Omicron variant is mild, it still can present a serious threat to persons who are unvaccinated. When we look at the breakdown by age group, you can see for the over 60, we had about 12.2%. For persons between the ages of 50 to 59, 10.3%. Persons 40 to 49, 17.1%. 30 to 39, 28.1%. 19 to 29, 24%. And under 18, 8.2%. What is significant about this graph is that if you combine the 19 to 29 and the 30 to 39, that comes to a total of 52%, 52.1%. And what this is telling us is that the persons who are mainly being infected are our young adults. This is the same group of persons who want to go to the strip, who want to go to mass gatherings, who want to play contact sport. But when we look at our vaccination coverage, this is the same group that has one of the lowest coverage compared to the other age group. And these are the persons who, if they get infected, because they're young and healthy and strong, they might do well. but most of these persons might be in contact with an older person, in their home, a younger person who is weak and fragile and who might not do as well. And so although you may become infected and you may recover, you can take the virus home to a vulnerable person in your home or your community, and they can succumb to it. And so we ask you to do the right thing, not just to protect yourself, but to go and get vaccinated so you can protect those around you. This slide is a very interesting slide because it basically graphically shows the current wave that we're in the blue. And so we saw that from December 24th, the cases started to rise. We had our first significant peak on about the 1st of January this year, and another significant peak on about the 6th of January this year. And so this is the wave that we are talking about, where the cases begin to rise. What is interesting is that the red graph that is below the blue, we see that the recoveries, that represents the recoveries, and that is beginning to climb. And those two graphs are getting closer and closer together, which means that most of the persons who are getting infected, they are now recovering. And we still believe that we are on the upward part of the wave, but within another week or so, we should be on the downward slope. But you can get us through this wave quickly by making sure that you protect yourself with the non-pharmaceuticals so that the wave is not prolonged. The entire OECS, they're experiencing outbreaks. We happen to be further along in this current wave compared to others. So when we look at our 7-day average, our last 7-day average per 100,000, you can see that our numbers are significantly increased compared to the others. But I'm pretty certain when I come back in another week or two, we should be on the other side of the curve, and that number should be down. And so I am just trying to reassure you, but don't want you to have any excessive complacency, because we still need to maintain our vigilance so that we can get through this wave. The cumulative cases per 100,000 shows that St. Kitts and Nevis, next slide, is right in the middle of the rest of the OECS countries. And so we will continue with our long-term planning to make sure that we contain this virus. And so what is the way forward? As it relates to certain institutions, for example, schools, we know that the schools will fully reopen on the 24th of January. I think the Minister of Education, when he was here last, said that the fifth formers were starting this week, along with the early childhood institutions. But school opens fully from January 24th. We believe that limiting COVID spread is key to keeping the schools open. And the best protection is through getting vaccinated for those who can be vaccinated, along with the use of the non-pharmaceuticals. And so we want to encourage the parents to make sure that by January 24th, if your child is between the age of 12 to 17, you'll have taken them to the health center so that they can start school with at least one shot, because we know one shot offers significant protection. That increases when you have the second shot. And if you qualify for a booster, you get even better protection. Make sure that your child has a proper mask. There is no point in you having a mask that is ill-fitting or one that is over your chin and not over your nose, and so you must have an appropriate mask that is worn appropriately. And these are the simple things that will help us to contain this spread. We don't believe that children should stay out of school because they may be positive. And so whereas earlier on in the fight against this virus, when you identify one or two cases in a school, the school was closed down. We believe that the best place for our children now is to be in the classroom, because being out of school for a prolonged period of time, next slide, could have significant negative psychological and psychosocial effects on the children. And remote learning is not for everyone. And if these children are not back in school, this prolonged absence from the classroom can have severe devastating effects for this generation of children. We need to make sure that we test children to stay in school. And so if we have suspected case, that child will be tested. If the child is negative, the child will stay in school. If the child is positive, then the child will be taken out. But I don't think you're going to be seeing the mass closure of schools going forward. We have to recalibrate how we address this virus going forward in a sensible and practical way. And so we should expect when school open that we will have positive cases. And so the same way when I said the fourth wave was inevitable, when school reopens, we are going to find positive cases in the school, but we'll address them in a timely manner. And once persons continue to be vaccinated if they can, once persons continue to wear their mask appropriately and to hand sanitize frequently, we can control the spread. And I also want to make a special appeal to the teachers to whom we entrust our children. You need to make sure that you go forward and be vaccinated. Mass gatherings. Now, mass gatherings can be petri dishes for viral transmission. People are in close communication. Often they might not be wearing a mask, they might be shouting, etc., and you can have a viral spread. But the Ministry of Health or the government that cannot micromanage every single function that occurs in the Federation of St. Kitts and Nevis. And this is where personal responsibility comes into play. And so one needs to limit their exposure at these events as much as possible. And so if the event can be attended virtually, you attend it virtually. But if you are going to such event, and there might be a temporary pause on mass events, I'm sure that Kwame will speak to that. But when these mass events restart, even after we get out of this wave, you can attend a mass event in a responsible way. And we know that if you're wearing a mask appropriately, if the majority of persons there are vaccinated, the risk of viral transmission is significantly decreased. We also want to appeal to the organizers of these mass gatherings. The personal responsibility comes down to you also. It is not right for you to apply to have a mass event, say to have a brunch, and then you have a BRAM where people are just doing something completely different. And so we want you to be honest on your application form so that we can know how to address these events in terms of making sure that we limit the spread of the virus with the control measures that we put in place. Prior to the start of the fourth wave, we were in contact with a number of the presidents from the different contact sporting events across the Federation of St. Kitts and Nevis. We know that everyone is looking forward sometime in the near future, in this year, to the resumption of contact sports. I do hope that over the last several weeks, the leaders of these organizations were using the time to engage their players, to encourage them to come forward so that they can make the 70% threshold of population coverage among the different teams that we were asking for, so that we can comfortably and safely restart these contact sporting events once we have gotten through this fourth wave. As it relates to testing, you would be aware that the Ministry of Health started the testing drive at the start of this fourth wave, and this testing drive is coming to an end this weekend. We learned a significant amount from the information that we gathered from this testing. We know that this variant, which is most likely Omicron, is highly transmissible, and it's infecting the vaccinated and the unvaccinated. We know, however, that the persons who are vaccinated, they have minimal, if any, symptoms. They tend to be symptomatic for a much shorter period of time, and they recover at a much faster rate. And so the persons who are vaccinated, they have been recovering or testing negative about 5 to 7 days after they would have gotten infected, whereas those persons who were unvaccinated, they tended to have more severe symptoms. They were more likely to be admitted to the hospital, and the recovery was much more delayed, about 14 days before they started testing negative. We also, as I said before, that though Omicron is less severe to the individual, collectively, based on the sheer volume of persons who can be infected at one time, it can be catastrophic to the healthcare system. And so it is not, the message is not that Omicron is mild, and so we can just throw caution to the wind. And so I want to ask the public not to get complacent, to continue to protect yourself with the best protection possible, which is the vaccine, and also the use of the non-pharmaceuticals. And so finally then, I want to ask those who have not yet accepted the vaccine to go forward and accept the vaccines that we know scientifically they are safe and effective and offer significant protection against severe disease, hospitalization, and death. A vaccine that you have more information than any other vaccine or any other drug that you would have taken. Ever so often, in my private practice, I would see somebody ask them if they are vaccinated. They say no. They would tell me that, oh, they need more information. And I will take up my prescription pad to write them something for the condition that they came for. But at first, I will scribble something that is totally illegible, 5 or so lines, and give it to them and say, make sure you take that. They say, yes, doc, I'm going to take it, or take every single thing. I see you back in 2 weeks. And then I will stop them and say, give me that prescription and call one letter on that prescription pad. And they cannot call one letter, but they were going out to take 5 things that I wrote there. But yet these are the same persons who are saying they want more information on the vaccine. There is information there. If you want information, you can go to a credible health professional. You can go to a credible site online, whether it's the CDC, the WHO, CARPHA, Pan American Health Organization, and get the information. But we want you to go forward and get vaccinated. This argument about not having enough information, we are past that. That is not holding water anymore. Billions of doses of vaccines have been administered worldwide so far, and we know that they're safe and effective. We want you to wear a mask on your face, covering your nose and your mouth at all times. There are some persons who are using the mask just as a pass. And so they're going into a business place, it says, wear mask. They put on the mask to go inside. They don't even cover their nose and mouth. They meet a friend in there and they want to talk. They right up in the person's face. They pull the mask down to talk. And then they, as soon as they come back out, even if they're in a crowd, the mask is off. This is where personal responsibility comes into play. It's a simple thing we are asking you to do. If you had to use a barrier method to prevent something, let's say, for example, even if it was a condom, you can't be taking it off every 2 seconds. Otherwise, the person will get infected. I mean, will get, pregnant. Pregnant, okay? Or you might catch a disease. And so it's the same thing. If the mask is there to protect you and to protect others, make sure you wear it appropriately and you wear an appropriate mask. We want to encourage you again to hand sanitize. And I want to make to businesses to make sure that your hand sanitization stations have hand sanitizers. Ever so often I go into a business places, I put my hand under the hand sanitizer, and some of them, they are empty. You need to make sure that some of you might be not knowing that this is so, but if you have a hand sanitizer, you need to make sure that you're checking all the time to make sure that it is filled with the appropriate sanitation device so that persons can sanitize their hand. We are encouraging you again to maintain your distance from others. We cannot micromanage everything, but it doesn't mean, as my mother used to say, every pan knock, you have to be there. And so even if there's an event that is being organized after we get out of this wave, there are going to be other events in the future. And so you can make a conscious decision not to go to some of these events, even if the event organizers are putting more persons into the space that they were supposed to be having the event. And lastly, I want to say that if you have any flu-like illness, you need to stay home. I know also that there are a number of persons who have been purchasing the home testing kits, and we encourage that because that's a way to keep you safe. But you also need to be honest with the information. And so if you had a home care kit and you test positive, you need to isolate, and it will be instructive if you inform us about your positive test. But lastly, I want to mention that the positive cases in our community, in our country, in any country across the world, are not just those persons who went forward and tested positive. Okay, and so if, for example, we learned that we had 3 positives in your church, in your school, in your class tomorrow, it doesn't necessarily mean that those are the only 3 positives. And that's why you have to treat every single person around you as if they are positive, and wear your mask, hand sanitize, and give yourself the best protection, which is the vaccine. Thank you.
Thank you very much, Dr. Wilkinson, for your presentation. It's one thing when you can't understand the doctor's handwriting, and it's another thing when you can't understand the doctor. But I think we understood you very clearly in your presentation. The other thing is that the hand sanitizers, especially the automatic ones, sometimes they are full. They are full with the solution, but they do not work. So you put your hands under them and nothing comes out. So sometimes they malfunction and people need to check up on those to get them fixed as well. I want to invite now the Superintendent of Police, Mr. Cromwell Henry, to give us his presentation.
Thank you very much, Leroy, and a pleasant good afternoon to all listening to this broadcast. I promised that I would not be as lengthy as the doctor. I was beginning to enjoy his presentation, very informative and filled with useful information that would keep us safe. However, we continue to see high numbers of new COVID-19 infections in the Federation. And we have heard that some of these cases were the result of person-to-person contact at some social events and large gatherings. In an effort to control the spread of the virus at social events, the Commissioner of Police, in consultation with the National COVID-19 Task Force, has restricted certain types of social events and activities. Social events that are approved, we expect that all persons will wear the required masks, adhere to social and physical distancing protocols, the hygiene protocols, and any other condition that is specified in the permit. Street vending remains prohibited. Section 5 of the COVID-19 regulations provides as follows. All street vendors shall operate within the confines of the public market or any other designated area approved by the relevant state agency or the cabinet. Several areas have been approved for this activity in addition to the public market. Some of these areas are the strip, the Newtown strip at Ponds Pasture, Shear Lane, and the food court at North Independence Square Street. We encourage you to use these areas and to avoid using the streets for vending. We once again appeal to everyone to always adhere to all the COVID-19 prevention protocols and the various provisions of the regulations. They are intended to reduce your risk of becoming infected, and so we ask that you always wear your mask when in public, maintain a physical distance of 6 feet from others, practice good sanitization behavior, avoid crowds and crowded places, and where possible, get vaccinated. Thank you.
Thank you, Superintendent Henry. That brings us to our question and answer segment for today. And the first question is, should people get a second booster shot? And if so, how soon after the first booster shot should that be administered?
Right now, the recommendation is that after you've gotten your first 2 primary shots, 6 months after, you can get a booster. We are not recommending as yet a second booster. However, there are one or two persons who would have received 4 shots, and I'll tell you why that is so. These are persons who would have been immunocompromised either because of some congenital disease, acquired disease, or they would have been receiving chemotherapy. And so these persons would have needed 3 shots initially instead of 2 to get to where you are with your robust immune system. And so these are the persons who would be now getting a 4th shot, okay, which is basically their first booster.
Thank you, Doctor. Is there any data on the number of persons who are infected more than once?
I can't give you an absolute number off the top of my head, but we know that if you got infected and you were not vaccinated, your risk of getting reinfected is great. And so we have a number of persons who would have been infected early on, recover, and have a second infection again. We also have 1 or 2 persons who would have been vaccinated and got infected with the Lambda variant and now infected with the Omicron variant. But again, these persons, they're still showing that they have significant protection through vaccination by having minimal, if any, symptoms. With the mass testing that we were doing with the by the Ministry of Health recently, there are some persons who just came along with a family member and got tested, not because they had symptoms at all, and they were shocked and surprised when they got the call saying that their result was positive. But when we speak to these persons, we give them the reassuring news is that the virus might eventually find all of us, but the fact that you are positive and you didn't even know, and that you are totally asymptomatic, shows that the vaccine works. And so that's why we want to encourage persons to go forward and get vaccinated.
I realize that the Medical Chief of Staff, Dr. Wilkinson, mentioned the Lambda and Omicron variants. Did we have the Delta variant in St. Kitts and Nevis?
I just want to take my time and answer that. When we had the quarantine period in place, there were 1 or 2 persons who tested positive while in quarantine for the Delta variant and recovered before they were released into the community. And so, yes, we had the Delta variant in the Federation of St. Kitts and Nevis, but we had no evidence that it was circulating in the community.
This next question calls for some differentiation. How can you differentiate between the common flu and coronavirus?
Now, I know that I've seen persons posting things online and circulating on social media about symptoms related to the common flu and symptoms with the coronavirus, but you really can't distinguish them clinically. Because first of all, we're saying, one, you can have COVID-19 and be asymptomatic. And so if you're asymptomatic, there's no way you can determine whether or not this person has or has not disease unless you test them. The initial symptoms also, the mild flu-like symptoms, etc., they are common with both of them. And so clinically, you may not be able to distinguish them. The only how you can tell is if you test the person. Another fallacy that persons have is that when you test positive for COVID, it could be that it is the flu that you have. The PCR test is specific for the COVID virus. And so if you test positive, we know that you have COVID. One can do other test to test for the influenza virus that causes the flu. But the flu virus is so common that we don't necessarily do that testing.
Is COVID infection rampant across the entire islands or clustered in some communities?
We are currently going through a wave, and we have been doing testing in different centers across the island and finding the cases. And so it is not necessarily confined to Bastille or Sandy Point, etc. What is also instructive is this. During the 2 weeks when we were doing the testing in St. Kitts, there was no testing being done in Nevis. However, we have basically a scientific study here because St. Kitts and Nevis is basically one population. There is free movement of persons across the borders. However, although there was no widespread testing being done in Nevis, we did not see an overwhelming of the healthcare system in Nevis. And what this means is that going forward, if we all continue to wear our mask and hand sanitize, we should be able to get through this wave. And yes, those who came forward and test positive, we know that they're positive, but there are also many persons out there who could have been positive. But it is not just focusing on the persons who are positive, but making sure those persons who are positive do not pass the virus on to someone else. And again, comes back, I know it sounds like a stuck record, but personal responsibility. Wear your mask, hand sanitize, try to social distance as much as possible. We have had persons who, families, you have one person in the house positive and the others are negative, and persons are able to comfortably isolate within a home and not infect the other persons by strict adherence to the non-pharmaceuticals. So please remember that.
And this next question, how many of the COVID-19 cases are imported cases?
I would say, although we would have had persons, well, first of all, we have to remember that if you are coming into the Federation, you have to have a negative PCR test. But I keep telling persons, though, the negative test is just as good as the time when you took it, because you could walk out of the testing center having tested negative and pick up the virus on your way home. However, by requiring that persons have a negative PCR test before they come into the Federation, it gives us a level of protection. The protection is not absolute, but it gives us a level of protection. There have been persons who came in, and when they were leaving, they test positive. And it could have been that they came in with the virus, was incubating it, and now that they're leaving, they test positive. Omicron, for example, did not start here in St. Kitts and Nevis, okay? And so it must have come in by someone who came into the Federation with a negative PCR test. But with that said, the vast majority of the cases that we mention here, these are persons living in the Federation of St. Kitts and Nevis, not persons who were flying in.
And this is our last question for today. With all the COVID-19 restrictions and guidelines, I was astonished to see how easy it is to visit patients at the JNF General Hospital. Why is it so easy to visit patients at the JNF General Hospital?
when we started out fighting COVID-19, before we knew the effectiveness of the non-pharmaceuticals, before we had effective vaccines made available to the people of the Federation of St. Kitts and Nevis, we had a number of restrictions in place. Many of you would have remembered we closed the entire country down. Eventually, we opened our borders. We had the 14-day quarantine followed by 9, then 6, and now you can test negative and move free. We also had a ban on visits to certain institutions, nursing homes, the prison, the hospital. But that comes at a price, because when somebody is lying sick in bed and they cannot see their loved ones, if you have a child in the hospital who is sick and you cannot go and visit that child, if you have a mother or a grandmother who is in the hospital with a terminal disease and you cannot go and visit that person, it can be very traumatic. As a matter of fact, there are a number of persons early on in the fight against COVID-19 who never got the opportunity to tell their loved ones goodbye. But we have passed that. And so we are saying that you should be able to move about safely, despite the fact that we have a virus circulating in our community. And so I will not use the word, it is easy to visit, but we have visiting hours. And when you come to visit, there are rules and regulations in place. And so you have to wear your mask, you have to hand sanitize. There's a limit to the number of persons who can go by the bedside. And so one should be happy that we are giving persons the opportunity to be with their loved ones when they most need them. But we need to be responsible. And so you cannot argue on both sides of the fence, where you want us to open up, but yet you're saying that you want us to prevent persons from coming to the hospital. Lastly, I saw that you sent me something where somebody probably misunderstood what I said as it relates to school. I never said that if someone is positive, they should be allowed to go to school. I said that we will be testing, and if persons are symptomatic and they test positive, they will be taken out. But what I said is that we should expect going forward that you will hear that there is a positive case in Sandy Point High School, or Baster High School, etc. But we now know what to do to protect ourselves, get vaccinated, using non-pharmaceuticals. And so, especially as it relates to Omicron, there is no reason for us to close the school down for an entire term for an illness that might affect a child for 5 days, and that child might be asymptomatic. Okay? And so we need to keep our schools open, but do it safely.
Thank you, Dr. Wilkinson. You were the only one today who came up and answered all those questions, and we thank you very much for that. We have come to the end of our question and answer segment, and I want to thank you for submitting your questions, and I hope that they were answered to your satisfaction. If not, of course, you can always submit a follow-up question, and we will try our best to answer at our next briefing. I want to thank you again, Dr. Wilkinson, for filling in for Dr. Laws today. I thank Dr. Superintendent Cromwell Henry for his presentation. I thank the Honorable Wendy Phipps. Of course, she has become such a part of these briefings. She is always here and showing her interest. Her presence in itself speaks volumes. I thank Mrs. Christmas Jacobs. It's her first appearance for the new year at these briefings, and we thank her very much for her continued service. We continue to thank ZIZ and the staff of ZIZ for bringing these briefings live on radio, television, and social media. We also thank Ms. Michelle Rodriguez, the Public Relations Officer at NEMA, and Dr. Marissa Carty, who does a lot of the work in terms of the reports that we receive, the statistics, and all of that. And we thank her very much. Thank you to all of you for joining us today for our briefing as we continue to update you and continue to implore that you do your part in adhering to the COVID-19 protocols to keep us all safe. Thank you very much. I am Les Roy Williams.
Maintain a separation of 6 feet or 2 meters indoors and 3 to 4 feet or 1 meter outdoors. If this isn't possible, masks must be properly worn. Businesses can provide hand sanitizer, conduct temperature checks, record customers' contact information, and manage crowds. Clean and sanitize high-touch areas regularly. Dividers or staggered seating can be used to maintain proper social distance. This protects workers and customers and prevents the spread of disease. We all have an individual and collective responsibility to avoid large social gatherings. These types of gatherings are deemed as super spreader events. Taking disease prevention seriously will enable a worry-free return to normal life. Our children deserve a chance to have a healthy and happy childhood. They should be able to enjoy their youth, have fun with their friends, learn in the comfort of a classroom, and interact with others in the community. That's why I chose vaccination. It has been over a year since the pandemic started, and our kids have been forced to adapt to new lifestyle changes. Therefore, it is my job to ensure that they enjoy a childhood free of isolation and restrictions without fear and worry. While we continue to wash our hands, wear our masks, and practice social distancing, let's take it one step further and do our part as parents to help our children stand a greater chance at fighting this virus. Visit the nearest health center or call the Ministry of Health for assistance. We all have a role to play, so let's roll up to roll out.
Yeah, I know we can make it. It's only just a phase. Once we're vaccinated, and everybody gon' be safe. Everybody gon' be safe. One kind, yeah. One people. We are roll up to roll up, yeah. 'Cause no man's alone. Do what's right, alright. 'Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to let it roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.